Children with asthma are impacted by the condition in many ways, frequently putting up with disruptions in their daily lives. Parents and caregivers are equally affected, considering the endless concern for their child's well-being, the unpredictability of asthma attacks, frequent hospital visits, having to miss work sometimes, as well as the financial burden treating a chronic illness. In this video, we will uncover practical tips and insights to prevent and reduce the frequency of asthma attacks in children. This is Pediatric Doctor at Home, dedicated to the medical education of parents and caregivers. Kindly subscribe if you get value from this or any other video in this channel. Thank you. Asthma is a chronic lung disease in which certain factors trigger the already hypersensitive respiratory system, causing inflammation and spasms of the tiny air passages inside the lungs. This consequently restricts the flow of air into the lungs, usually manifesting as coughing, wheezing, breathlessness, and chest tightness. If your child experiences breathing problems and you are wondering whether he or she has asthma, there is a video on this channel for you with detailed explanations. That said, asthma is a disease that can be controlled. Preventing asthma attacks in children is important to preserve daily activities and ensure a healthy childhood free from the constraints imposed by the condition. These 5 steps will help minimize asthma flare-ups. Stick to your child's asthma action plan. The Asthma Action Plan is a personalized document for children with asthma that outlines appropriate steps to handle asthma. The plan includes the list of medications and correct doses that a child should take, physical activities to be avoided, and what to do if symptoms worsen. Every child's action plan is unique. What works best for one child may not work for another, so it is necessary to work closely with your doctor to draw up a plan tailored to your child's specific needs. Take medications as prescribed. The medications given to children depends on the severity of asthma. So based on the frequency of symptoms, the response to treatment, and interference with normal activities, a child's asthma severity can be classified as intermittent or persistent, mild, moderate, or severe. The medications used in the treatment of asthma are either controller or rescue medications. Controller medications are long-term medications generally taken on a daily basis to control inflammation in the lungs, help stop the airway from reacting to triggers, and help prevent asthma flare-ups. Rescue medications, on the other hand, are used for immediate relief during an asthma attack as they open the airway quickly. Albuterol is the most common rescue medication, and it can be administered using a nebulizer machine or via an inhaler with a spacer. If your child has been prescribed any medications, make sure to give them exactly as directed. Do not stop the controller medicines even if your child feels well. Also, your child's rescue inhaler and spacer should be within reach at all times. Be observant about the particular things that trigger asthma flare-ups in your child. Common triggers include colds and respiratory infections, pollen, pet dander, dust, mold, tobacco smoke, strong odors, and cold air. Once you identify triggers, take steps to minimize exposure to them. Maintain a clean living environment to reduce dust and mold. Consider removing carpets from the home. Use allergen-proof pillows and beddings. Clean air filters regularly. Tackle any mold issues. Keep children away from secondhand smoke. Groom and bathe pets regularly and consider keeping them out of the bedrooms. Monitor air quality and pollen forecasts and keep windows closed during high pollen seasons. Maintain a healthy lifestyle to help support the lungs. Eating a balanced diet, exercising regularly, getting adequate sleep, and maintaining a healthy weight all play a role in asthma control. Schedule regular follow-up appointments with your child's doctor to monitor asthma symptoms and adjust the treatment plan if necessary. In conclusion, let's ensure to protect our children against asthma triggers and embrace the power of prevention. Know that despite our best efforts, asthma attacks may happen from time to time. In such situations, treatment must be started immediately and medical attention sought promptly. Thank you for watching. Remember to subscribe.